Hi, everyone. I'm James Milan. Welcome to the Town Hall update for this week. And this week I am joined, as we periodically are, by our Director of Health and Human Services, Christine Bongiorno. Christine, thanks for being here, as always.
Of course. Thank you for having me.
We are going to get right to it, honoring the value of your time. So let me just start by asking you, our local expert for sure, to give us a general COVID-19 update for Arlington.
Sure. Thank you. Well, thank you for the opportunity. We are definitely unfortunately seeing a very similar increase in cases of COVID here in Arlington as we have been seeing across the state, across the country. The Delta variant is something we're seeing spread very easily from person to person, whether they're vaccinated or not vaccinated. And so, yeah, that's what we're seeing at the moment. So we've seen our cases, triple in over the course of the past few weeks. And many of the people that we're seeing are unvaccinated. So we still have a number of unvaccinated individuals in our community. And we're also seeing vaccinated individuals getting COVID and spreading it to others within their family units and other areas within their lives.
So in a lot of ways, this is just what you have been warning about and we've been fearing in a sense, is that with this particular variant, we're just dealing with a whole new kind of situation where, again, being vaccinated is not the entire answer. Of course, it's protecting us from the worst consequences. But nonetheless, I guess you're finding that the data supports the idea that you can transmit the virus as a vaccinated person. So we've got to be very careful going forward, sounds like.
Absolutely. Yes. I mean, we're seeing very few hospitalizations and deaths among the vaccinated, which is exactly what we're hoping, for with the vaccines. We're seeing that they're extremely effective. So, in our office, we continue to work with residents that are unvaccinated and with others that are unvaccinated, just to urge them the importance of the vaccine, because we know that it saves lives and it saves long-term health consequences. I think that's the other big issue that we've seen with COVID.
Obviously, getting vaccinated is the single most important thing to do and best step to take for everybody. You've made that point over and over again. Hopefully, we are continuing to get that message through to those who need to get vaccinated. But what the rest of us need to do also, of course, is follow masking and other guidelines. Can you tell us what the latest word is in terms of mask mandates here in town?
Sure. So last week, the Board of Health voted to enact a mandate for all persons within indoor spaces open to the public that they wear a mask while indoors. And really the reason for that is because we saw our local numbers increasing dramatically. We also saw our county numbers, according to the CDC. Middlesex County is in between substantial and high transmission area. So, based on the CDC recommendation, anyone in those high and substantial areas should be masked while indoors. So the board really used that data point to drive their decision, in addition to our local data. And we regularly look at the MWRA sewage data. I think that really for us is one of the easiest areas to look at to understand just the general incidence of COVID within our communities, because not everybody that has COVID knows to go get tested because they may not even have symptoms. So we know that is our best way of understanding where we're at with COVID in our community. So the board looked at those data points and decided that the mask mandate was important because we hope that it will slow the spread of the virus from person to person, whether they're vaccinated or unvaccinated. And so, we hope that the Delta variant spikes quickly and goes down, and that we can roll back that mask mandate. But until that happens, and until we start seeing those numbers come down and the CDC map go from this higher substantial down to low risk, we are we're going to continue to need to promote masks. And, we look at masks as, somewhat of a burden for people, but it's also something that will save lives. It will help protect people that are at high risk. We still have a significant population within our community that's unvaccinated. A lot of people say that children are at low risk for getting serious complications from COVID. But what we do know is that when we expose large numbers of a group, whether they're low risk for serious complications or not, we will see complications. We will see hospitalizations and deaths in that population, no matter what. And we want to protect those individuals. So, masking is a simple step we can take right now to help curb and slow down that transmission.
On another slightly different topic, news has come out recently that the FDA has given its kind of official approval to the Pfizer vaccine and perhaps others. What are the implications of that for us here in Arlington?
It's great news. I mean, we've known for quite some time that the vaccine is safe. Millions of people around our state are vaccinated with these types of vaccines, and we have seen, that the vaccines are saving lives. So we know that the efficacy and the safety of the vaccines are there, and the FDA's stamp of approval really just sort of confirms that for us. We're hopeful that anyone that was holding out previously will jump on board and will take a vaccine. What this means locally is, we hadn't been giving out Pfizer in the past because it is a bit more complicated. It does require, a different set of requirements for those administering. So, but we will be moving forward with accessing that vaccine, and we're going to be partnering with the school department to offer that vaccine to youth and families that are eligible. And we're hopeful that anyone that maybe is too busy over the summer, or anyone that's in that new 12 to 13 population, that they'll be urged to come in and get that vaccine from us.
Yeah, so again, just to kind of recap or remind people, it is now officially approved for those 12 and up, I believe. And so is there actually, you were saying that you're going to be looking to, make that available. I understand that there may be a clinic coming up in September for that purpose.
Yes. So the school department will be posting and advertising for that clinic to families that are eligible. We'll also reach out to families in other areas within the community that may not be in the Arlington Public Schools that are eligible for the vaccine. Yes, we will be hosting a clinic. It's early September right at the beginning of the school week. That vaccine is officially approved by the FDA for those 16 and over, but the emergency use authorization is still in place for the 12 to 16. And there are a lot of reasons for that. And, there are a lot more stringent standards that need to be reviewed that Pfizer obviously has submitted to the FDA. And it just takes a little bit of time for that to catch up. And, it soon will be approved officially, but, at the moment it's 16 and up officially.
Well, thanks for that clarification. Mm-hmm. Obviously, it doesn't make too much difference on the ground right now in terms of, everybody who is 12 and up can get the vaccine and should, obviously. All right, Christine, we've covered several topics rather quickly. Anything that we've missed or that you'd like to add before we let you go?
No, I think that covers it. No, I appreciate the opportunity to speak with you today. Thank you, James.
Thank you. I have, of course, been speaking with our Director of Health and Human Services, Christine Bongiorno, for this town hall update. Thank you, Christine, again for your time, and thank you out there for your time. Get vaccinated if you haven't, please, and keep those masks on. We're going to get through this. This is James Milan. Thanks for joining us. See you next time.